And then, let's see, yeah. On this side here, you have the calcaneonavicular ligament. And then it's also called the spring ligament. And now it kind of acts almost like a sling or a hammock. And what's this bone right up above it that can support it? What's between the calcaneus and the navicular? Yeah. So it goes across under here and helps support the talus. So there's, most ligaments, they go from one bone to another. But in this case here, it's attaching from the calcaneus to the navicular, but then there's also another bone in between. It doesn't actually attach to it, but it helps support it. So that's going to help support the arch. Yeah, it looks like I don't have any pictures of the bursa and the ankle. Okay, so on the ankle you have the bursa, you have the Achilles. So there's subcutaneous, which is basically would be out between the tendon and the skin. So it's on the outside surface here, just like on the knee we had the prepatellar. So you have subcutaneous meaning below the skin. And then subachilleal, where do you think that would be? Yeah. So if you have the, if this is the Achilles tendon here, you'd have the subcutaneous one, and then you'd have the subachilles. Okay. And then sustentaculum tali is part of the calcaneus. It's this little prominence right here that helps to support the talus. That's where the name comes from, sustentaculum, meaning it sustains it, it holds it up. So there's a bursa under here. Because again, what structure do we have that's what do you call this area here? There's a tunnel, right? Tarsal tunnel, so there's a lot of tendons and things that go in there. So a lot of times when you have tendons, you have bursa that help keep things moving smoothly. I guess this isn't specifically mentioned in the notes, but it's more like a ligament than an actual contractile tissue, so this would still be part of under the inert tissue. So you can just add that in. You have the plantar fascia, which, like I mentioned, it attaches to the calcaneus and then goes out towards the metatarsal heads. So it actually attaches. There's a lot of different attachments where, it's a tendon, like a ligamentous little slips that go into the different bones. But primarily it's going into the phalanges. So it kind of helps us support the arch. And we'll talk more about the actual condition, plantar fasciitis. The thing that people complain of when they have plantar fasciitis is that when they first put weight on their feet in the morning, they feel that pain right at that tuberosity right there. Okay? That's the classic thing that they're going to say. I mean, it may hurt throughout during the day, but they're going to say that it bothers me the most when I first put weight on my feet in the morning when I get up. And basically it's just tugging on that area there. And it tends to be a chronic thing that happens over time. And what you'll see sometimes on an x-ray is you get a bone spur right there. So where that tissue attaches, you get a spur right there. All right, so now we get into the contractile tissue. So we're moving on to page 160. And we're basically going to divide the lower leg into different compartments. Anybody remember which kind of compartments we have? So anterior, what kind of action are those going to primarily do? Right, dorsiflexion. The posterior is going to be what? Plantar flexion. And then lateral is going to be eversion and Depending on which muscle you're talking about, it could be plantar flexion and it could be dorsiflexion. All right, so posterior compartment, you have a deep layer and a superficial layer. So this would be the more superficial layer. You have the gastroc and the soleus. Right? And now, which one of those muscles crosses two joints? And then soleus just crosses one joint. And then you have, of course, we talked about the Achilles tendon. So this, the Achilles tendon is basically the muscles of the posterior, the superficial compartment. And then in here you have the deep muscles. So the deep part of the deep compartment is flexor digitorum longus, flexor hallucis longus, and tibialis posterior. And those basically are what goes through the tarsal tunnel. The contents, there's a mnemonic for the tarsal tunnel. It's the simplest version of it is Tom, Dick, and Harry. So it's tibialis posterior, digitorum longus, and hallucis longus. And then the other version of it is Tom, Dick, Van, Harry, so vein, artery, and nerve. So you have the three tendons, and you have a vein, artery, and nerve that goes through there. And then you have the lateral compartment, where you have the peroneus. If you're old school, it's called peroneus. If you're new school, it's fibularis. So you have the longus and the brevis. And what's this one right here? It's a peroneus tertius, or fibularis tertius. That one goes in front of the malleolus, so that would be a dorsiflexor, versus the other ones are going to be plantar flexors. And I think actually this tertius, I think, is part of the anterior compartment. I'm not sure. It could be either anterior or lateral. Okay, so then now we get into the nerve tissues. And then we're talking about the tarsal tunnel. So again, it's tibialis posterior, flexor digitorum longus, flexor hallucis longus, and the tibial artery, vein, and nerve. And then you actually have two parts where it's the anterior and posterior tibial nerve. And then that's going to continue down and be the medial plantar nerve. Okay, so it's kind of like, in carpal tunnel, it went to the more medial side here, and in the foot, actually though, that's lateral, but the thumb side and the big toe side. So tarsal tunnel, you have compression of the nerve here, and then you have symptoms going down this way here. And then vascular tissue, the deep veins of the calf, so that's going to be significant when we talk about deep vein thrombosis. And what's happening there is you're getting clots that form in the leg, and what's the complication of that that's serious? That goes to where? The lungs. Right? Okay, so if you're playing basketball and you have an injury or you feel something snap like a twig, hopefully you're not going to have this type of an injury where your leg comes off.